I feel honored as I introduce our next speaker, Vaidya Bhupesh Vashisht. He completed his BAMS from Kurukshetra University, followed by MBA from IHMR Jaipur. He is the crucial driver behind the genesis of As Ayurveda. He has prodigious medical counseling skills and treats patients with Rasa Aushadhis, Panchakarma, naturopathy, and Ayurvedic dietary regimen. His clinical experience with chronic conditions such as chronic pancreatitis, diabetes mellitus, pancreatogenic diabetes, and various pain and age related degenerative disorders backs him to treating these grieving medical illnesses. He has worked on the leading health projects of esteemed Indian and international organizations such as FICCI, Federation of Indian Chambers of Commerce and Industry, GIZ, German Corporation for International Cooperation, and ILO, International Labour Organization. A devout daily reader of Charak Samhita and Bhaishajya Kautuhalam, where the Bhupesh Vashisht has developed a unique system of giving personalized care to his health seekers using the ancient wisdom in these scriptures. He is an avid reader, diet and lifestyle consultant, and fitness enthusiast. He also writes health blogs and articles. I would like to request Vaidya Bhupesh Vashisht to begin with his session.
So I'm a Nev Vaidya. Yesterday I was a bit juggling with the words or maybe the flow of presentation and as in who is my audience. So what I would be telling them in terms of prameha, madhumeha and other related comorbidities. So I will not be much divulging into shastras. So it's not that they are not valuable, but if we see that prameha, madhumeha comes under vataj prameha, but how many patients in today's context come with a condition that doctor straight away and tell I have polyuria, या मुझे मूत्र ज़्यादा आता है. The moment, especially I do my practice in a very tough terrain, the terrain of North India, right, where people are, all doctors themselves, they have reports with them and they always barge into your OPD and tell them, here is my report, what you can do. But at the same time, people, the general masses are getting very intelligent. The moment they call our receptionist, they tell us that आप diabetes का treatment, Ayurvedic treatment करते हैं. So while there are problems, it warms my heart that people are finally getting into the shoes of thinking of Ayurveda as a mainstream medicine, not alternative. And about time we should shun this notion that Ayurveda is an alternate medicine. It is, of course, mainstream medicine, which we as an Indian should follow as a prime treatment modality for us and as well as for our health seeker. So not getting into much, build up the story, I'll continue with the things. So this is the flow of presentation, right? So these are the myths, common myths. When I was a student of second year professional in Government Ayurvedic College, Kurukshetra, my teacher of Kaya Chikitsa told me that, or told us, the entire class, that madhumeha, diabetes cannot be cured, it can only be managed. Then, as when you practice, you use yukti pramana, right? And I'll tell you my small journey as well, that how why diabetes played a major role in my reconnecting to Ayurveda. I used to be a corporate guy. I did entire my job in biggest corporate houses of the country, but why diabetes played a major role for me making an atheist of Ayurveda to a believer of Ayurveda, right? So these are the myths that as an art teacher told that it is not curable, but there are scientific evidence and even the doctors of Western world now conclude that diabetes can be totally reversed. So it's not manageable, it's curable, it's reversible absolutely in nature. And it's a condition of urban populace or it's a condition of riches only. That's not true. Unfortunately, in our country, which is already, having huge economic cost due to so many conditions, infections, viral conditions, unfortunately, we are beating the burden of non-communicable disease as well. And diabetes is ranked highest in terms of giving us that opportunity cost. The people who are the lowest strata of society are also having diabetes mellitus now, right, which is giving us huge burden. Our government is giving huge burden to our government as well. So it's not specific to the higher rich and HNI people only, right? And it's the condition of riches which I just mentioned. And type 2 DM can be controlled with oral hyperglycemic agents. Well, that is also not a true. Why we can bust this theory? A patient with type 2 diabetes mellitus, if it gets uncontrolled, will eventually have to rely on insulin. So these both terms are now misnomer. That when a person is eventually have to take insulin, that it cannot be termed only type 1 or type 2 or insulin dependent diabetes mellitus. To stay on pills forever, well, more than Oshad plan or medicine plan, I advocate diet and lifestyle a lot in my practice. So I use a 3-pillar approach to my patient, and that 3-pillar approach is a diet, lifestyle, and medicine, ahar, vihar, and Oshad. And I have seen personally, and most of you must have seen as well, diet and lifestyle play a huge role in this condition. So fat is the culprit. These are some of the myths which I found from the patients in my general practice, right? That fat is the culprit. So the moment people ask in our IPD and they come up with a question, kya desi ghee khana hai? So doctors and scientists of Western world has, these guys are, enemies of desi ghee. Whereas we as a practitioner have added desi ghee a lot in our practice, and people have seen no, because fat is directly not related, as long as it is natural fat, is not related to raising your blood sugar level in the body. So these are some of the myths. Now this is the facts and figures. If I am a marketing guy right now, I want you young Vaidyas to see this chart, facts and figures. This is your target audience, right? If you're not targeting your audience, not only in India. So India is both sufferer right now, and we are the savior of humanity at the same time. We were in pandemic, we gave Ayurveda, we exported Ayurveda to the world like never before. Same case is that we are, because COVID was infectious in nature, everybody talked about COVID. Now we are already in pandemic, and this pandemic is directly burning on the pockets. But whereas if Ayurveda Charya, young Ayurveda Charyas who will be going to the, if I use the word market, this will be your target audience. This is the map of India, as I told earlier, not related to the urban and rich people. It is expanding to the lower strata of economy as well. So these facts and figures continued. It's a increasingly common metabolic first in the NCDs. DM is one of the 4 main NCDs, a top 10th cause of death globally. So एक बात मैं अक्सर अपने पेशेंट्स को बोलता हूँ कि डायबिटीज़ खुद कुछ नहीं कहती है, बट अपने साथ बहुत सी चीज़ें लेके आती है, और वो and it is one of the main causes of mortality. 15th global list of leading causes of ears and lung life loss. So you can imagine the productivity a person who is suffering from diabetes can lose. 3rd highest risk factor for global premature mortality. 2nd largest number of children in India. That's very unfortunate for us, by the way, that we are the 2nd largest community. Our kids, our growing population is the 2nd largest community in terms of type 1 diabetes, because it is directly related with the genetic inheritance as well. Definition of Madhumeha. Well, you can go to your home and read all these steps. I'm not a person who will be telling you that what is the terms and things given in Shastras, right? I'll be dealing more into my practice, things that I used in my practice, and the results I got as a very, but the most inexperienced Vaidya, I would say. So diagnostic criteria, most of the patients would come in your clinic and tell them, this is my HbA1c report, आप बताइए आप इसमें क्या कर सकते हैं. FBS more than 126 mg, Decimal, so these are the standard criteria of diagnosing diabetes in a patient. These are signs and symptoms and risk factor. Yeah. So non-modifiable risk factor would be genetic predisposition, disposition of family history and diabetes, race, ethnicity. Americans are usually more because of their sedentary lifestyle, and which is coming in India as well. So this is one of the most risk is highest risk factor leading to the diabetes, obesity, unhealthy diet and lifestyle. So the pandemic of this this epidemic of diabetes was not visible 20 years back. What happened in our lifestyle is that we have exported our meals from abroad. Now we mostly rely on processed, preserved meals, which are not native of our staple diet at all, right? Inadequate sleep, we sleep quite late in the evening and we wake up very late in the, so sleep cycle directly affects diabetes mellitus. Types of prameya, we all know, again I will not be here to tell 10 covers, 6 pittas, 4 vatas prameya. These are the type 1, type 2 pancreatogenic or type D diabetes, gestational and others. Before getting into my case studies, one beauty of advocating a good diet and lifestyle is that I, other than diabetes, work in pancreatitis as well. So we are lucky enough that our patients never got type D diabetes who have, because pancreatogenic diabetes or type D diabetes is a comorbidity which appears within the 5 years of having pancreatitis, the first attack of pancreatitis. Yeah, so mainly, as I said, we deal with lifestyle, medicines and diet, the 3 pillars of Ayurveda. Diet, ahar. So again, there won't be a standard specific diabetic diet chart because most of the diet plans advocated by American Diabetic Association have failed. They always advocate that you should eat less fat in your body, but if you remove less fat or fat from your diet, which is a healthy source of so many things, right, you tend to add more high carbohydrate, and from where that high carbohydrate is coming in the form of breads, biscuits or beer as well. So these are the 3 B's which I immediately remove from the diet of our patient. The new healthy approach is to eat 4 to 5 times a day, which is a healthy meal, portion controlled and balanced combination of CPF. So CPF stands for carbohydrate, protein and fat, and they should be maximum in natural resources, no fancy items by the way. So we studied in our classes in our as a kids that we should eat carbohydrate, protein and fat in the ratio of 3:1 or 2:1. Even then, even today it is quite applicable. All these fancy diets, high protein, high fat, these all bring the repercussions with them. 4 to 5 times, this is my dietary regimen which I give to my patients, and high intake of vegetables. I keep fruits, even we keep them, we ask them to eat mango as well because it's a natural source of sugar, and I have not, by the way, seen patients having huge spike of sugar even after having mangoes, right? So culprit is our gut, culprit is our Agni, not the fruit or fat for that matter. As I said, given healthy source of fat in terms of almonds, avocados, etc. Okay, so why we are suffering? Sugar is not the culprit. It is the sedentary lifestyle that we, or maybe the unhealthy source of carbohydrates, which are the culprit. Most of people will come and tell you that we don't have time for workout. So you need to tell them any workout is better than no workout. Walk, crawl, run, read, relax. This principle of 3R is what I follow usually. It gives you time, run as your workout. Read is that you are gaining something. Even if you want to read about your illness, you should read and relax. So meditation, all these techniques, yoga, pranayam, they have helped hugely in the patients of diabetes in keeping them, because stress directly trigger your blood sugar level. Either the patient can go in a hypoglycemia or a hyperglycemia as well. So Vihara, Yogic Kriya, this is that these are the things which I advocate to my patient, or the patients who come to us and get admitted for 21 days to 28 days and get healed. Aushad, I have again not mentioned. There are so many medications in our Samhitas. So this is the prerogative of a physician, of a Vaidya, that what medication they need to decide. You can decide even from the 20 or even the 200 would not be suffice for you to treat the patient. All you need to use your sense, the patient's condition, only then you need to add medication according to them. So yeah, so my whole intent is to tell you again, this my conversation directly, I'll be conversing with you directly. It's not to the Vaidyas who have experience. It is my, as an, somewhat elder of yours, I would like to tell you that why my journey has, from an atheist of Ayurveda, that I am a believer of Ayurveda. So I used to make fun of these Hindi books, Sanskrit books, right? I joined a corporate job, doing very well in that. But I personally fell ill. And it is those churana, those Oshadis, because my father is also a Vaidya, then came to rescue, for my rescue. And from there, I believe that the first patient I treated was of diabetes mellitus. And why this entire build-up, why the world is looking at you, and why this huge number is in front of you that you need to see as your target audience, because these people are looking for you, and you're not telling them that we are lying here, we are latent, we need to come out, we need to treat you. Now this is a patient who is an IES officer. She is an MBBS, MS, surgeon, right? She came initially with a skepticism, but once we sat and discussed, right, she got the idea that he is making sense, that why insulin is not acting on my body cells, right, because they are clogged. So I kept her on a diet, lifestyle, and medication plan. Within the 3 months, she was jubilant. She was excited that I was on so many medication, and within the 3 months, things have happened. Again, patient would come with the reports to your clinic, and you need to answer that what you understand is a different matter. What the patients understand is of paramount importance. It is imperative mostly. You need to tell them that how this can be cured, and today's world is all about evidence. The more evidences you keep, and the more samyak jnanam pramana, why we call it, because evidence is the proof. आपको एविडेंस देना ही है, आपको अपने लिए कलेक्ट करना, आपको पेशेंट के लिए कलेक्ट करना है, and your patient becomes your speaker. Then this lady is a doctor of modern medicine, but she has connected me, she has opened up her MLM for me, and so many doctors of modern medication approached us to get the cure of diabetes mellitus. This is a history which so basis on patient to patient, we advise them. There are patients who will come and tell, हम तो इस बीमारी के लिए कुछ भी कर देंगे. I keep them to pace up I practice Langan a lot in my own practice as well, and I guide to patients as well. She decided I'm okay with 24 hours of fasting in a week. There are patients with whom we have done the fasting, continuous fasting of 48 hours and 72 hours. Well, the idea is not to keep their fasting or random sugar in check. The idea is to pace up their Agni, to improve their BMR, so that they can eventually, burn those extra pounds, those extra kilos, and those extra inches, so that the insulin sensitivity starts activating in their body and working on their cells. Right, this is the same case, a different case, patient with an age of 56 years. She was told by a doctor that you have to eat these anti-diabetic medications for eternity. But she chose Ayurveda. She was a sapient woman. And within 3 months, you can see from 8.4 to her HbA1c level came within the range. We did Lekhan Basti as well for this patient for 15 days. These are the complications and comorbidities. I have not got much into the comorbidities, but we have treated some of the diabetic wound cases as well. And this is the example of that diabetic wound. This patient this wound was not healing from last 4 years. This patient belonged to another state. He came to us. We kept him for some in-house admission, and then we started Vranavasti, got to pull a Kalk for him, and after 9 days he gave some of the sittings with us, and this is you can see within 9 days the wound which was not healing. The first one, the condition was very bad. The second one was started to healing, and the third one was completely got healed. So he had the same diabetic wound from last 4 years, but within 90 days, 3 months from cure of Haryana, he was tied up with the eating and all these antibiotics, medication, and even take IV injectables as well to get healed. But what finally cured him? Ayurvedic treatment. That is, so these are the 2 slides I entered in the very last. That's all I had for this. Another story is when this young lad of 30 years was diagnosed with diabetes mellitus. He was asked for insulin, taking insulin as well. But the problem with insulin is that if you keep on adding it, eventually, and the patient is obese, so then the patient cannot go back to the krish avastha. You cannot do aptarpan chikitsa for a longer period of time for the patient. The patient came with 15.2 HbA1c, and within 6 months, the patient got 7.1 HbA1c. All signs, his currently OHA are to reduce to the minimal doses from 2000 mg from insulin units. The patient has come down to 7.1, and the doses are, he has enrolled to our program, diabetes reversal program, and I hope he can get rid of this deadly disease. That's all from my side. Thank you so much for listening to me patiently, and thank you so much.